Are we live yet?
No, not yet.
Okay,
Yes, go ahead. Oh, okay.
all right.
Just now we are.
Good evening, everyone. Calling the Board of Health meeting to order at 6:36 PM on October 17th, 2022. Do we have any public participation tonight?
We do, we have two. The first person is Daniel Klopp.
Hello. I am the new epidemiologist here at McHenry County Health Department, so it's really nice to meet everybody, and yeah, I hope I get to learn everybody's names.
Welcome.
Welcome aboard.
Thanks for coming. And then Dorothy Clark.
Yes.
Just
a visitor. And the cousin to Joe Clark over there.
Thank you. Is that it?
That's it.
Okay. Department and division updates. Melissa, would you like to lead off?
Sure. So some exciting news, at least from our perspective. Our application for recertification was approved by IDPH, so we're certified again for another 5 years. It goes from the original certification. We had asked for an extension due to COVID. Many health departments did. So that 5 years actually started last November 4th of 21 and goes through November 3rd of 2026. So this is one of those things that we have to do to be a certified local health department, which makes us eligible for the local health protection grant that we get. Also, ARPA funds, so we're gonna be meeting with the county administration and county finance next week to review the eligibility requirements and our draft request and sort of further refine that. And then we plan to bring our request to the Board of Health in November after we have that meeting and get on the same page. Facilities, so over in Building A, they're still working on the exterior, what they call the exterior envelope rehabilitation project. The windows were supposed to get installed this week, but there's been a delay, so that timeline's gotten pushed back. So we can, give you an update as that progresses. And then Susan and I are meeting tomorrow with the nursing staff. There have been, we had the meeting on the 25th. There are still some outstanding concerns, so we're going to sit down and talk about those tomorrow. So I can give you an update after we sit down.
Thank you. Who was responsible to doing the grant work the recertification work?
A little bit of everybody. Primarily, it has to do with our community health assessment. That piece, the organizational assessment that we brought forward, that's all a component. And then there's an application which is very, very minimal information and just affirming that we have done the appropriate steps. And then it gets sent to the state. They reviewed our I-plan. They had a couple of questions. It went back to Susan's staff. They made the requested updates, sent it back, they re-review it, and that's when they decide, make their determination.
Great. Well, thanks. Great job. On to divisional reports. Manager Mianskowski. Did I say that right? Did I get it right?
Yes. Year-to-date income shows a $580,000 deficit, which is primarily due to $245,000 less in collected animal control tag registration revenue, $300,000 deficit due to late shipment of the flu vaccine. The flu vaccine amount will be recorded in October as it was received in this month. We also corrected and resubmitted TB and immunization, public aid, and private insurance billings. So we will see an increase in those receipts over the upcoming months. Year-to-date expenses shows us $4 million below in projected expenses due to $1 million less in expense salaries and fringe due to the vacant positions that we've spoken to previously. We also are $2 million under projections in contractual services, $1.2 million of that is accounted for as open purchase orders. We were also $142,000 under budget for medical supplies. $123,000 of that is accounted for as well as open purchase orders. Finally, we're $300,000 under budget in expenses due to the state vaccine arriving late, as previously explained previously in regards to the flu vaccine. That's all I had.
How are we tracking then are we tracking year to date at budget, below budget, above budget?
We're tracking below budget in regards to expenses, and like I said, income, year-to-date income.
You think that'll change in the next 2 months, or?
Well, it's due to timing. Like I said, we should see a recoup, due to, the TB and immunization, billings, as well as timing due to the, grant receipts.
And animal control, Mary Ellen's not here tonight, correct?
No, but Ann will give a report for
Okay.
Mary Ellen, but it's not gonna cover
The tags.
the tags.
Okay. Thank you. Joe, any questions? Anyone have any questions for Henry? No? Thank you. Director Marin?
Thank you. I'm Mary Ellen tonight. She is out ill, so we hope she gets better soon. There is a rabies and microchip clinic on Tuesday, October 18th and October 25th from 1 to 4 p.m. Tomorrow's clinic is full. Next Tuesday is 3/4 full. Dogs are being accepted. They can register in advance, either online or by calling. They are actively interviewing for an office assistant, an officer, and administrative coordinator positions in animal control. They've started to get more applications. They did an update in Kronos, and it seems to be, really helping pull in some applicants. They're hosting a microchip clinic the first Saturday, November 5th, from 11 to 1 p.m. Microchips will be free to veterans, $5 for seniors, and $10 for everyone else. Finally, they are hosting a spooktacular event through the end of the month. Most cats and kittens adopted for $50 with spay, neuter, registration, and rabies vaccination. Again, it's one that an application has to be filled out prior to that, reviewed, and they will call you for an appointment. So that's all I have.
Thank you. Anything else from you?
Well, Melissa did ours,
That's herself?
So I just did Mary Ellen's, Melissa.
Oh. Are you doing yourself too?
Mhm.
Okay.
She kind of filled everything.
Oh,
for
okay. Okay. Director Noem?
So we were requested by Boone County to assist with some food service training that they were doing for their establishments. So our food supervisor, Christine, did that this week, and we presented on food service plan reviews for new construction. We were recently made aware of some changes to the Illinois Water Well Construction Code. Honestly, I don't think we were notified by Illinois Department of Public Health that they had changes ongoing. But it should not impact the revision that we have currently proposed and before the county board. But what it essentially did was provide some permit exemptions for some specific well modifications. So we're in the process of doing some formal notifications to our well contractors. With the cooler weather comes the end of the bird and mosquito surveillance for West Nile virus, so I'm always happy to follow that. But we collected 7 birds this year, one of which was positive, and we collected 227 batches of mosquitoes, 5 of which were positive. So our percentage, our positivity rates for the mosquitoes is much lower than the state rate, and our bird positivity is really right in line with what we've seen overall in the state of Illinois. We had our final comprehensive recycling event this last Saturday. We had about 323 participants, as verified by Melissa, who was our traffic controller and vehicle counter this weekend. So it was a good turnout. We have one final event this coming Saturday, which is a tire recycling event. That one will take place at McDott. That one is pre-registration is required, and that's still ongoing, so if anyone has any or you know anyone does, please let us know, because we would like to have those. So it's right online, it's a very easy process. Our participation rate is fairly low right now, so we're doing some outreach to the Farm Bureau, because we always hear from Farm Bureau members that are always looking for that. So if we can accommodate, some of that, we will definitely do that over the next week. And then finally, we are finalizing our draft for the solid waste plan update. We're required to do that every 10 years, so we've been working with the Solid Waste Committee of the Environmental Defenders for McHenry County and our Solid Waste Advisory Committee, so we've gotten some good input from them. And so we're just finalizing our draft, which will be done by Monday, and then we will formally send that out to get public comment, and we will be presenting that to the Planning, Environment, and Development Committee on November 1st. And then after that's done, I'll actually be bringing it back just to provide a short overview at the November meeting for the Board of Health.
Thank you. Joe, you want to pick up my tires in the morning?
Sure.
I got a meeting to go to. Director Karas?
Thank you. So in addition to Daniel Kwok, I'd like to introduce two other new employees we have in the nursing division. Jenna Wagner, some of you might recognize her from the COVID clinic. She was a temp employee with us, and now she's a permanent employee.
Welcome.
And then Mindy Adele is my new assistant director for the clinical section. So part of their orientation is to come to the Board of Health meeting to see how we operate. So that's why they're here today.
Excellent.
We've gotten the flu vaccine in finally. There was a delay in the shipment of that, and mixed up with the order, and actually sent us a different type of flu vaccine, but it's the same, it's just this different brand. So we got what we needed. So those clinics are out and rolling, and the invitation to the county employees was sent out today to get them all vaccinated. As Melissa mentioned, the I-Plan was approved. Ryan and Megan also presented at the Committee of the Whole, and did a great job with that. We're super proud of the work that they've done. A lot of work involved with that project, and how it came together. So I was real proud of the outcome of that. And then to just quickly update you on Ebola. I don't know if many of you have been seeing that in the news of the Uganda outbreak. So we are on kind of like preparedness mode to be ready. And just so you know what's happening, they are checking, screening travelers from Uganda that are coming through O'Hare, and determining what their risk level is. There's a 3-level tier risk level. And what we're supposed to do is anybody that comes from that area, that their end location would be McHenry County, we would be notified by IDPH, and we would be expected to monitor them for the total of 21 days. And the 21 days would start when they left Uganda. So they would let us know what that is, and we would be monitoring them. Most of the monitoring is done electronically. So if you were around here before when Ebola was a big concern, we had to go to their house to take their temperature every day and monitor them. Now, because of technology, we're able to do that electronically, so it makes our job a little bit easier. We are reaching out to hospitals to make sure they are prepared, that they have supplies on hand for PPE, because they are expected to be able to take in anybody that we would have, that we would be sending to them into the emergency room, and they would be transferred to an Ebola care center, which is Rush Hospital Northwestern. Figure out what the third one is. There's a third one down in Chicago that will take any of those patients from any of our hospitals. So we're getting, being prepared just to make sure that we are ready if this would happen. This is a real concern because it is a strand. It's called the Sudan strain, which there is no vaccine or monoclonals, unlike the Zaire strain. So it is a concern. And there are 60 cases and rising in Uganda, so we're watching that very closely. That's all I have for tonight.
Thank you. Any questions for Susan? Okay, on to the consent agenda. Does anyone have anything they want to pull out for discussion? Do I have a motion to approve the consent agenda?
I'll move to approve this consent agenda.
Second?
I'll second.
Any further discussion? Darlene?
Ms. Parrish?
Yes.
Mr. Clark?
Yes.
Ms. Morowski?
Yes.
Ms. Carmen?
Yes.
Dr. McGuire?
Yes.
Ms. Gaffney?
Yes. We've got two contracts. 5A is Elmhurst University Agreement. Susan?
Yeah, but both the Elmhurst and Western Governors University are just new affiliation agreements to take on nursing students, primarily BSN completion students.
Do we have a motion to approve, let's do them individually, Elmhurst University Agreement?
I move to approve the Elmhurst University agreement.
Second?
Second.
Thank you. Any further discussion?
Is this for their public health rotation?
Yeah, their
That's cool.
final semester.
Good, that's good. Good.
Go. Darlene?
Mr. Clark?
Yes.
Dr. McGuire?
Yes.
Ms. Morowski?
Yes.
Ms. Carmen?
Yes.
Ms. Parrish?
Yes.
Ms. Gaffney?
Yes. Do we have a motion to approve the Western Governors University Agreement contract?
I'll motion to approve the Western Governors University contracting agreement.
I'll second.
Any further discussion? Darlene?
Mr. Clark?
Yes.
Ms. Carmen?
Yes.
Ms. Parrish?
Yes.
Dr. McGuire?
Yes.
Ms. Morowski?
Yes.
Ms. Gaffney?
Yes. Do we have any board issues this evening? This is kind of scary.
Yeah, we're moving quick.
Yeah. Okay, you received your information and communications package. Do we have any need to go into executive session this evening? Any further discussion on anything?
The weather, we're gonna talk about the weather.
Ann?
I neglected to say, and I think an email went out, but just to kind of make it official, the union decertified, so.
Oh,
we're
yeah.
no longer
That's
have a
right.
union shop. We're working, Mary Ellen, Melissa and I are working on, different pay grades and redoing CPQs and things such as that. So that's very exciting. Deb and I are currently working on the personnel manual as a whole for an update. The county updated theirs in July, so we wanted to make sure ours kind of jive with what they have. And a few updates such as boosters and COVID boosters and things such as that. So we spent 3.5 hours the other day locked in a room. I think it was this room, so I feel like I'm still here. Going through everything front to back, cover to cover. So we will be having some personnel committee meetings and a lot of red lines to read through, so.
Thank you.
Okay, thank you.
Is our final meeting is November, correct?
Yes,
For the year?
unless you would like to add one for December.
I think we're good without one, unless anyone has a particular reason we need one. Well,
Well, speaking of that, so we do have a personnel committee meeting. So we'll bring the merit there, the proposed merit, which is 4%. Then the recommendation of that committee will come to the November board meeting. Technically, the approval for the merit goes to the county board the prior week. So, do I have that right? I think their meeting is before ours. So they will have approved it, then you will approve how you want it allocated, right? So in years past, we have done it equally, everyone gets, the 2.25 or the 3%. So this year they're proposing 4%. So we will bring that recommendation to the personnel committee. And unless we want to have, to the ARPA question, if you're okay with us bringing our recommendation straight to the Board of Health in November, otherwise we would need to have a finance committee meeting ahead of that recommendation to the full board.
Joe, what are your thoughts?
On the ARPA, it wouldn't hurt to have a committee meeting.
Okay, we can do that.
So that you can go more in depth with the committee versus at a whole board meeting.
Okay, then I'll work with Darlene and we will find a time, because we meet, like I said, we meet next week, next Monday. So, and then we meet next
Tuesday's personnel.
Tuesday for personnel, so probably maybe the following week or the week after, we could look for a time to have a finance committee meeting. Okay.
Anything else, anyone?
I went to the solid waste, meeting and Kelly's done a phenomenal job on that project. I was like, wow.
Appreciate that.
Yeah, she did a great job. And this week, for the Waste Reduction Committee, for the defenders, we are having a little social, and so it'll be a great opportunity so Kelly can talk to a lot of municipalities and see what their inputs are, so.
Absolutely.
So we're excited about that, so. More to come for waste, or less waste.
Less
Less waste.
Well, it's that time. Does someone want to make a motion to adjourn?
I'll make a motion to adjourn.
I'll second.
Wait, who made the motion, Julie?
I did. Lori second.
Voice vote.
All in favor?
Aye.
Opposed? Thank you, everyone. Thank you for coming out tonight. And thank you, the new staff. Did everyone get their flu vaccine? Are we still doing them or done?
Yeah, you need one,
I do need one. I do need one. Is it too late to get one? Did you get one, Joe?
Are we going out?
I'm not. I gotta.
Julie?
You got 3 minutes.
No, I was going out.
I cannot.
No.
I cannot. I would, but I cannot. The wind is blowing everything all over the place.
I'm out tonight. I know it's early, but I'm gonna take advantage.
Do I need 2 minutes?